Broadcast is now starting. All attendees are in listen-only mode.
Good morning. We're going to start in a few moments. We're just giving people time to kind of get logged in. We'll start in a few moments. Good morning. Welcome to the 2019 GDA Group Health Plan webinar. Today, your medical insurance benefits manager, Christy Biddy, will be your host. Ms. Biddy has 30 years of medical insurance experience. It will help you determine which plan will work for you. Welcome, Ms. Biddy.
Hi, good morning. Thank you for joining us today, and hopefully I will be able to answer most of your questions that you have about our 2019 health insurance. We will open it up at the end for any individual questions, and then also if you have questions that are more specific to your situation that you really don't want to ask in a public forum, you are more than welcome to give any one of our health insurance representatives a call, and we'll definitely be able to help you with that. So we'll get started now. Okay, so what we're going to cover in today's webinar is just health insurance in the news in general, specifically the healthcare exchange, if that's an option you're considering, and what your choices are going to be. When looking at health insurance plans, what you really need to be looking at and comparing with each one, which is going to determine what your rates are going to be. And then why choose the GDA? What do we have to offer you? We'll go over health savings accounts, which one of our plans qualifies for. We'll go over that just so you have some general information on it. And then at the end, we will specifically cover the GDA 2019 group health plans. Okay, first of all, which we are extremely proud of this year, is that we have no premium increase whatsoever on our group health plans for 2019. This is something that we have been working on behalf of our members each year. We've gotten our premium increases down lower and lower each year. And this year, Blue Cross came back with a slight increase, but we leveraged our group power and we actually negotiated that down to a 0% increase. So our rates are going to be exactly the same for 2019. And no matter which language you say it in, no, nil, nine, we have no increase for 2019. And like I said, if you are considering the healthcare exchange for next year, just a few little information so that you are more informed when you go over there to look around. The 4 carriers that were on the healthcare exchange for last year are going to be your same choices for this year. They've all filed plans for 2019, and as the last thing that I could find as of late June, they had not filed the filing details of that. So we don't know yet if the coverage areas are going to change. Most of the counties, it's divided by county, most of the counties in the state of Georgia will have just one option. There will be a few counties that has 2 options as a carrier for their health insurance, but most of the counties are only going to have one. Your choices for 2019 will be Blue Cross Blue Shield, Kaiser, Alliant, and Better. And just so you are aware, when you're looking around at the healthcare exchange, all of the plan, well, I'm not going to say all, most of the plans in the healthcare exchange are HMOs, which mean you will have, it's a managed plan, which means you will have no out-of-network access. And then also most of the plans have narrow networks. Most of your metropolitan cities, that might not be an issue for you, but more in your rural and suburban areas, the further away you get from a metropolitan city, that might be an issue. We have heard of people having to go see a specialist, like a cardiologist, neurologist, and they've had to travel up to an hour, hour and a half away from their home because of the narrow network, and a specialist was not in their network and that was close to where they lived. Okay, so the health insurance that is offered through the GDA is a group health plan. So what is the difference between a group health plan and an individual plan? Well, the biggest difference is that under a group health plan, it is something you can offer to your employees. And we'll go over that in a little more detail further along in the webinar. But also typically when you're part of a group health plan, it can lower the rates because the risk pool is shared over a larger number of people, as opposed to where you have a smaller employer plan where the risk pool may be only shared between about 10 people. So right now we have about 1,100 primary insurers on our health insurance, and that does not count dependents. So we have a very large risk pool that we can share that cost in. And that is one reason, again, that we've been working year after year and getting our premium increases lower and lower. The more insurance we have on our plan, the larger the risk pool, the lower we can keep our rates. Plus, you will probably have to answer some questions on an individual health plan. They might not necessarily can rate you on those, but they can ask you on the health questions. You are also on an individual health plan rated on your age, your gender, your location, and then also everyone, and that is on everyone on the plan. So if it's you, a spouse, and children, you are rated on each of those for everyone on there. Also on an individual plan, you can get random increases during the year. Actually had one insured call and said they received 2 premium increases over the year. One of them was when they had a child and that child was added to their plan and that increased it. And then the other one was just a random increase that they received, and they had no idea why that was added to their rates. You can also, on an individual plan, get random cancellations. I had one insured call and said that theirs was canceled on their birthday and they had received no notification of that. So you will not get a surprise cancellation with the GDA. The only reason we cancel any of our insureds is due to non-payment. That's it. Okay, so the Georgia Dental Association, the group health plan that we offer is actually called a MIWA, which is a multiple employer welfare arrangement. And the definition is an employer benefit plan or any other arrangement that provides a welfare benefit, such as health insurance, to employees of 2 or more employers. The good thing about the MIWA is that you, as long as you are a member of the GDA, since it is a group health plan, that is what the group is our membership of the dentist. So as long as you're a member, you can join the group health insurance for yourself. You can also open it up and offer it to your employees. The main thing on a MIWA is to be consistent. Consistency. I cannot stress that enough. If you do open it up to your employees, you have to be sure and open it up to everyone. If you do not, you can get into the realm of someone filing a discrimination claim with the Department of Labor. So again, it's totally up to you how you manage it. You can offer it to all full-time employees and part-time employees, or you can just do it to all full-time employees. You can subsidize the premium if you want to, but again, if you do, you have to be consistent and either offer the same percentage or dollar subsidy to everyone. Again, you absolutely do not want to have a discrimination claim filed against you with the Department of Labor. But again, that's the good thing about the MIWA. You get to determine all of those rules yourself, and you also get to set the waiting period. Like you have a new employee start. Do you want them to be eligible for the first of the following month, or do you want them to have to wait 90 days before they can enroll? That is totally up to you in the way that you do that and the way you manage it. But again, I cannot stress enough, you have to be consistent. If you set up a 30-day waiting period, then you need to do it for all employees. You can't make an exception for one and do it sooner. So the bottom line, MIWAs are designed to give small employers access to lower cost health coverage on terms similar to those available to large employers. And again, the reason being that risk pool is going to be larger and can share the cost on that. Okay, so when you're comparing plan choices and looking around to get the plan that best fits your situation, what you want to look at, and these will be the things that determine your rates. You want to look at the deductibles. The lower the deductible, the higher your rate is going to be. Also, out-of-pocket maximums. The lower your out-of-pocket maximum, meaning the insurance company is going to have to pay more in claims on your behalf, the higher your premium. You want to look and see what your co-insurance is, and this is the amount that pays after you've met your deductible. Say like you were to go into the hospital, you meet your deductible, the amount over the deductible is the co-insurance. Is your insurance company going to pay 70% or 80%? And are you going to be responsible for the additional 20 or 30%? You also want to look and see if you have primary care and specialist visit copays, or if you're limited to the number of those that you can do each year. We're finding that a lot of the plans now limit to like 3 specialist visits with copays for the year. And then anything over that, it goes into deductible and co-insurance situation. Also, are the plans open access? Do you have to have a referral from your primary care doctor to go see a specialist? A lot of times you will have to ask about that because it's not very widely advertised. Also, do you have out-of-network coverages? If it's an HMO plan, you are not going to have out-of-network coverage. On a PPO plan or a POS plan, you will. So you definitely want to check into that, especially if you're in an area, maybe a rural area or in an area kind of far away from medical facilities. You definitely want to check into that. And then the other thing, kind of go hand in hand, your provider network and your drug formularies. You will not see that widely advertised either, but whoever the carrier is that you're checking on these plans with, they should be able to provide you with the provider network and the drug formulary, to be sure that your providers are going to be in network. And then also if you're on any type of maintenance drugs, whether those are going to be covered under your drug formulary or not. Okay, so why go with GDA? Well, first of all, we partner with best-in-class insurance carriers. Our carrier for our health insurance is Blue Cross Blue Shield. We also, on our business lines, and we also offer personal lines insurance also. We partner in best-in-class carriers with those also. Like I was saying at the beginning, we leverage our group power. We got our increase down because of our group power to a 0% increase this year. If you're on an individual plan and your carrier comes back for next year with a 12% increase, you pretty much can't negotiate with them. It's either you accept it or go to another carrier. That's your choices. But with a group, we do have that negotiating power on our behalf and on your behalf. You also have an attentive staff working solely on your behalf. A lot of times, if you have to call the insurance carrier directly, you're going to be on hold an hour and a half, especially at this time of the year where people's plans are renewing. So most of the issues that you might have, say like having to call in and change your address with your carrier, we can handle that for you. So you're not having to call the carrier directly and sit on hold for an hour or more. Also, dentists make up our board of directors. They are the ones who look at the plans and approve those every year. So they know what dentists and what dentist offices are looking for. So they make up our board of directors and have that final decision on what plans we offer. Okay, so why choose GDA? Why go with our group health plans? Well, we offer great plans at competitive rates. We look and see what our members want and what kind of coverage they want, and that is what we tailor our plans to. We did not have a HSA compatible plan 1 year, and we got a ton of phone calls with dentist and dentist office wanting us to add that back. And we did. The very next year, we added that high deductible health plan back that qualifies for an HSA. Our team shops for you, so you don't have to. Generally, about at least every 2 years, we send out requests for quotes from all the carriers to get the best plans and the best rates for you. And it's just worked out that Blue Cross has consistently come back with the best rates for our situation for our group health insurance through a MEWA. But we do look at that every year. We just don't automatically go with Blue Cross Blue Shield because we do want to get the best rates and plans that we can offer you. Again, the leverage of a negotiating power of a group, which is, again, what we did this year. Your rate is also guaranteed for 1 year. You will have no random rate increases in the middle of the year. If you're on family coverage and already have 2 children on there and say like you have triplets during the year and add those to your coverage, it will not cause your rate to go up. So as long as you don't make any changes to your plan at the beginning of the year, like to go from, which would cause a rate difference is if you went from employee only coverage, say like you got married and added your spouse to it. Of course, that would change your tier of coverage. So that would cause your rate. But as long as you're not making any changes whatsoever, that rate is guaranteed from January 1st through December 31st. Again, no surprise cancellations. I did have an insured call me one time, and they were actually paying their premiums just like they should. They took their child to the doctor, to the pediatrician, and then they got there, and then the pediatrician's office told them their insurance had been canceled. That's how they found out. So the dentist called me that afternoon, and I was actually able to get him enrolled in our health insurance that day. So there was no lapse in coverage whatsoever. We also have no medical enrollment questionnaire. This is guarantee issued. So once you submit that enrollment form, that's why we call it an enrollment form, not an application, because once we receive that form, your coverage will be effective as of January 1. There's no underwriting, no approval or anything. Since this is group insurance, again, there is no age banded, so it doesn't matter your age like it would on an individual policy. All of our plans have a broad network coverage. We do not offer narrow networks. And as a matter of fact, when you travel outside the state of Georgia, the insurance travels with you, and it goes from Blue Cross's POS network to their PPO network. All of our plans are open access plans, so you do not need a referral to go see a specialist. If you know you want to go see a dermatologist, just look one up in the provider network to be sure they're in network. Call up and make an appointment. That's all you have to do. There also is no limit on the number of copay visits you can have to a doctor. If you needed to or wanted to go once a week, so 52 times in the year, you could go 52 times, and as long as it was a doctor's visit, all you would have is that copay. We also offer optional vision coverage with our health insurance. Now, an ophthalmologist is covered under your medical insurance. An optometrist, which are generally the doctors that you find in the eyeglass locations like JCPenney, Target, Lens Crafters, Pearl Vision, those doctors are generally not covered under your medical insurance, but would be covered under the optional vision coverage. You also get into, if you go in network, you get into a discounted program and copay with glasses and contacts. If you go out of network, then it turns into a reimbursement program. But for example, I think the premium is annually is less than $70 a year for an individual, but just on glasses and frames alone, you could be reimbursed up to $100 per year. And glasses, frames, and contacts are every year, not every 2 years. So you could do that every 12 months. Also, there's no minimum number of enrollees within your office that has to participate. If the dentist does not want to participate but wants to offer it to his employees, he can definitely do that. Does not have to be enrolled in the plan to be able to do that. And then again, also you have a dedicated customer service team here on your behalf to work on your behalf. We work for you. We're not working for the insurance company, so you can definitely call us with any questions or concerns that you have, and we will try and get those taken care of for you just as quickly as possible. Okay, one of our plans does qualify for a health savings account, so let's go over that for just a second so you know what the basics of a health savings account is. You have to be enrolled in a qualifying high-deductible health plan to be able to open a health savings account. You would be responsible for setting up that health savings account at any institution that offers it. Most of the major banks like Wells Fargo, Chase, Bank of America, they can help you set that up. Also, you get pre-tax savings on your tax return. There is a line item on there, and I'm sorry, I don't remember what the number of the line item is, but it specifically says on there your HSA contribution for the year. So that is where you would be able to get the pre-tax savings on that. You can also contribute up to age 65. Once you turn 65, you can no longer deposit money into that. You can continue to use the money, but when you turn 65, it no longer has to be used just for health-related expenses. It can also be used for anything whatsoever. So you lose the benefit of being able to deposit to it, but you gain the benefit of being able to withdraw the money for any reason whatsoever. The funds automatically roll over to the next calendar year. You never lose that money. It stays in there. You can contribute up to whatever the maximum is for the year. So like you never use that money. It will be in there when you turn 65 to be able to start using it. If you switch, say like you're in a high deductible health plan this year, didn't really work out for what you needed, so you want to go back to a more traditional plan next year, you will still be able to use the funds in that health savings account the following year to cover your deductibles and co-insurance and prescriptions. So you will still be able to use it. You would just not be able to deposit any more money into it. So for 2019, the HSA contribution limits for an individual is $3,500, and for a family, it is $7,000. And if you will be age 55 or older by the end of 2019, you may contribute an additional $1,000. Now, because say you do enroll in our high deductible health plan, you don't have to set up the health savings account. It just means you qualify for it. Say like you do set it up. No, you don't have to deposit the maximum contribution in it for the year. You could put $100 in it, $5 in it. It's totally up to you. It just means you are eligible to set that up and start getting the pre-tax savings by depositing money into it. Now, going over our plans that we offer for 2019, if you were enrolled in our 2018 insurance, they're the exact same plans, exact same deductibles, co-insurance, co-pays, formularies, and again, no rate increase. It's exactly the same. So say if you are currently insured with us, and since the plans are the same, you're not wanting to make any changes whatsoever, then you don't need to do anything. This your 2018 coverage will automatically continue over into 2019 with no changes whatsoever. Now, say like you have vision and you want to drop it, then you would need to complete that the health enrollment form. You want to add vision, again, you need to complete it. If you're in the 500 plan and you want to switch to the 2500 plan, you would need to complete that form. And also if you're adding or dropping a dependent, you would need to complete the form. And then say like on January 1, you go on Medicare. So you would need to complete the enrollment form canceling that coverage with an effective date of December 31st, 2018. So first, our first plan is our POS 500 plan. POS stands for point of service. All of our plans are through Blue Cross Blue Shield. They're all point of service plans, meaning you have in-network, out-of-network coverage. They're all open access plans, meaning you do not need that referral. They all use the same provider network. So regardless of whether you're on our POS 500 or our POS high deductible health plan, the provider network is going to be exactly the same. And we do not offer narrow networks. So where you're going to find the differences in our plans are your base benefits, your deductibles, co-insurance, maximum out-of-pocket, co-pays, and so forth. So on all three of our plans, preventive care, and let me stress this, it's the way that the provider sends the claim over to Blue Cross Blue Shield. As long as it is coded as preventive, when they send it over, it will be covered at 100% with no copay, no co-insurance, no deductible, nothing whatsoever. Now, if by chance the doctor sends it over, say like you go in for a colonoscopy, you think it's going to be coded as preventive, but then the doctor sends it over as diagnostic, then you would be responsible for the deductible and the co-insurance. So again, it's all in how it's coded when it's sent over to Blue Cross Blue Shield and they process the claim. So, and again, on all three of our plans, preventive care is 100%, covered 100% with no copay. But on our POS 500, that is like our Cadillac plan. It has a very low deductible, which is almost unheard of nowadays, with a $500 individual deductible. Maximum out of pocket is $4,400. All covered expenses go toward your maximum out of pocket. Including your prescription costs, prescription copays, your deductible, doctor copays, all covered expenses go toward that maximum out of pocket. And once you reach that maximum out of pocket, Blue Cross pays all future covered expenses at 100% through the end of the year. Now, again, this is on a calendar basis. So if you go to a physician, your primary care doctor, it's $25. If you go see a specialist like a orthopedist or dermatologist, it's $50. And again, right there, referral for specialists, no, you do not need that referral. On the prescriptions, there is no separate deductible. On the prescription coverage, you immediately go into a copay situation based on what tier where your drug falls. And if you go to our website, which is gdaplus.com/health, HEALTH. We have our prescription formulary link right there where you can enter any type of maintenance drugs you're on, and you can find out what tier of coverage they're covered under each plan. And you can see what your costs would be. Those rates listed at the bottom are the monthly rates with vision and without vision. We have employee-only coverage, employee and spouse, employee and children. And when you're insuring your children, it doesn't matter whether you have one child or 25 children. That rate is the same because the cost is averaged across that entire tier of coverage. And the same thing with family. It's you, a spouse or partner, and your children, regardless of how many children you have on there, that rate's going to be the same. The next plan is our POS 2500 plan, and by far, this is the plan that we have the majority of our insureds enrolled in. This is your more common plan that you're going to find out there on the marketplace. Has a $2,500 deductible, maximum out of pocket of $7,150. Your physician and specialist copays are $30, $60. Now, one thing to note on this, the prescription coverage does have its own separate deductible. It's $200 per person for a total of $400 for the family, but that cost does go towards your maximum out of pocket for the year. Once you meet that deductible, and that deductible only pertains to your tier 2, 3, and 4 coverage. Tier 1, which is your more generic drugs, antibiotics, that does not pertain to the deductible. You immediately just have a copay situation of $15 on that. And then again, you can see the monthly rates with vision and without vision. And we also, just so you know, so you're not hurrying to write down the monthly premiums, we have all of this listed on our website. And then our last plan is our POS high deductible health plans that qualifies for an HSA. Again, preventive care, and this is the only thing on this plan that is covered without having to meet the deductible, is covered at 100% with no cost to you. Other than that, you do have to meet your deductible before Blue Cross plays anything on your claims, and that is including prescriptions. You do have to meet your deductible for that before you go into a copay situation. Now, two main things, there's several things that qualify for the HSA, but the two main things to know is that to qualify for an HSA, it does to be have a minimum high deductible, which this plan does at $5,000. The other thing is that the insurance carrier provides no coverage, provides no payment on claims other than preventive care until you've met your deductible. So that is what qualifies this plan for the HSA account. Has a maximum out of pocket of $6,550. Once you meet your deductible, then it does go into a copay situation to go to the doctor. You have a $30 primary care, $60 specialist. And then once you meet your deductible, again, in your prescription coverage, you go into a copay situation, $15, $40, or $80 for tier 3, or a percentage situation if you go into tier 4. And again, those are the monthly rates listed at the bottom of the sheet right there. So some of the frequently asked questions I get, and we do have a frequently asked document on our website that you're more than welcome to go over and look at also. But our some of the majority of them that we receive are any plans HSA compatible. Yes, we have one plan and one plan only, and that is our HDHP plan, which stands for high deductible health plan. How can I check to see if my provider is in network? And this is also the same if you want to check to see if your any type of maintenance drugs are covered under the formularies. If you go to our website, which is gdaplus.com, and then /health, HEALTH, we will have a link to our provider network right there, and also a link to our prescription formulary, so you can check it right there on our network without having to set up a user ID or password or anything like that. Does a dentist need to be a GDA member? Yes, he does. That is our group. This is group insurance, and that is what constitutes our group, is our GDA membership. Can dental practice employees enroll even if the dentist is not enrolled? Yes, as long as the dentist is a member of the GDA and offers it to his or her employees, then yes, the dental practice employees can enroll, but the dentist has to offer it to them in order for them to do so. Is there a minimum number of staff that must enroll? No, there's not. You can just have one employee enroll if you want to, if that's the only one in the office that does want to enroll in the insurance. Must a dentist subsidize the premiums? And also the next question kind of goes along with that also. Must a dentist offer health plans to employees? As long as you have less than 50 employees within your office, you are not required to offer health insurance to them. You're also not required to subsidize the premium for them. Regarding offering it to them, we definitely encourage you to do that if you have less than 50 employees. There's no cost to you if you don't want there to be, if you don't want to subsidize it for them. So it's just a great option for your employees to have so they can have other choices outside the healthcare exchange. Must a dentist subsidize the premiums? No, you don't have to, but if you do, again, consistency. You've got to be consistent in the way you manage it. If you offer it $100 to one full-time employee, then you have to give it to all employees that you're offering the coverage to. And how is billing handled? Beginning around sometime between December 15th and December 20th, we will send the monthly statements out, and that will be the same time each month that the monthly statements are mailed out, between the 15th and 20th. And the payment will be due right around the first of the month for that month's insurance premium. On the enrollment form at the top, it will ask for your GDIS group number. If this is your first time enrolling, leave that blank. I will assign that once I get your enrollment form. That will be your group billing number. But for the first time, you can definitely leave that blank. I will assign that. So just to go over a few things, we want to be sure that you know our open enrollment ends on November 21st, which is the Wednesday before Thanksgiving. To get more information, all of the information that we covered today regarding the plans, rates, and everything is on our website. The enrollment form is on our website, the formulary link, the provider link, and that website is gdaplus.com/health. To enroll, all you need to do is complete that enrollment form, and you can return it to me either via fax at 404-634-6099, or you can email it to me at christy@gadental.org. As long as you provide an email address on your enrollment form, we will send confirmation to you and next steps included in that email also. If you want to call and talk with someone specifically, our number is 770-395-0224. We have several representatives that can answer your questions and help you and get you enrolled. We are also offering 2 more webinars. We will have this one posted on our website, and we will also be hosting 2 more if you have any colleagues that would be interested in attending. The next one is on October 24th at 12 p.m. And then November 9th will be our last one, which is a Friday at 10 a.m. But again, you're more than welcome to go to our website or to give anyone here within the office a call, and we will be more than happy to answer you. Again, let me just stress, if you were already insured with us for 2018, you're not making any changes. You don't need to do anything whatsoever. You don't need to call us and let us know you're not making any changes. It will just automatically continue. If you are making changes of any sort, you do need to complete that open enrollment form. And then if you are new to our insurance, you will need to complete that enrollment form and send it over.
All right, now we're open for any questions. Please type them in the question box. We'll give you guys a few moments to type any questions. It looks like Missy Morrison has a question. Could you type it in the question box for me so I can read it out loud?
It looks like we don't have any questions, so hopefully that means I answered every question that anyone has. But like I said, if for some reason you have a question that is more specific to you,
There's
I'm sorry, we just got one.
the question is, I got a little confused during the MIWA explanation. Are you saying this is a type of MIWA?
Yeah, actually, we are a MIWA. We're considered a multiple employer welfare arrangement because us as the association, the MIWA is made up of the employers within the association. So it's made up with all of our member dentists. So we are a MIWA. We're not your typical group insurance. Most of your group insurance is provided through your employer to all employees that work within that company, where we're a little bit different because all of ours are made up of our GDA member dentists and their employees that they offer it to.
Any more questions? I also want to clarify, GDA staff is available to assist with any claims?
Yes, if you're talking about if you have any issues with claims, yes, definitely. The first thing would be to try and contact Blue Cross Blue Shield directly. If you're on hold for a long time, don't do that. I mean, if they can pick up and help you, but usually that's all it takes is a phone call to Blue Cross Blue Shield and it will get it taken care of. But if not, again, don't call them and sit on hold for a long time. You can call us and we will be able to help you out with any claims issues. We actually have a direct contact that we deal with. So you're not getting a random person every time you call over at Blue Cross and having to explain your situation over and over and over again. We deal with one person over there. So that can, and usually that expedites the process also with only dealing with one person. But yes, that is definitely something that we can help you out with.
I have another question. My current insurance ends on November the 30th, 2018. It sounds like this insurance begins on January the 1st, 2019. Would I need to stay with my current insurance for the month of December 2018?
Actually, that's a good question. Actually, no, you would not have to. That is a qualifying event. Outside of open enrollment, there does have to be a qualifying event in order to enroll in our insurance. Qualifying event would be, say, like you get married and want to add your spouse. Now, if you're already married, just didn't insure your spouse at the beginning, then randomly want to add them during the year, you can't. But if you get married and want to add your spouse, that is definitely a situation where you can do that outside of open enrollment. So other coverage ending is a qualifying event. So we could definitely, if you're interested in get your coverage effective as of December 1st. If you're interested in doing that, if you would give one of us a call, you would need to complete our 2018 enrollment form. That's the only difference. The plans, again, are exactly the same. The rates are the same. The only difference is the enrollment form that you would need to complete.
All right. Are there any more questions? All right. If that's all the questions you all have today, I want to thank Ms. Biddy for hosting this informational webinar. Remember, this is one of 3. Please feel free to join one of the other webinars should you have any more questions. They're October the 24th and November the 9th. If you need specific information, please feel free to contact your health insurance representatives today. Thank you for joining. Have a good day.